The mission for Carolina Center for Cleft and Craniofacial Surgery is really to be a community resource as we see it. We want to be the collective place where families and patients can go to find out more about their diagnosis, certainly their plan, what options exist, and as we like to say, build the roadmap for what's ahead. The patients, it's seeing what they're faced with at a very early age for reasons that were not of any of their doing, and to see the resilience that is created when these people move through these challenges from the very beginning of life and do it with grace and courage. It inspires me to keep doing what we're doing, try to find better ways to do what we do, more specific to the patient and their family's situation, more successful, and to come alongside them in that journey and see if we can't make parts of it just a little bit easier than it would be otherwise. I feel very strongly that we are advisors, not decision makers. We feel that parents will make the best decision for their children. Our job is to be their experts and guide them and teach them kind of what options exist, but not make the decision for them. I like to think what sets us apart is that we're very versatile. Since we're based in a private practice, the multidisciplinary aspect of the care that we provide is obviously super important, and it's a great service to parents to have them be able to come to one appointment and see 7 or 8 or 10 providers in one afternoon. And they exist beyond just the surgery that we provide to include pediatric dentistry, orthodontics, speech and language pathology, audiology, ENT, physical therapy, occupational therapy, behavioral health, nursing. That's just a sample of the individuals that we have that are present at each of our meetings. We have another collection of providers that are maybe called upon less frequently in the community, but are certainly at the ready. That includes pediatric neurosurgery, pediatric ophthalmology, genetics. And so we really have what we think is a very broad toolbox of individuals for whom this type of care is routine in their practices right here in the Charlotte area. We can access the latest technology. We can work with more than just a handful of practitioners. In fact, we work with the whole community to bring together practitioners who are cleft focused with various viewpoints and experience levels. I can't imagine the difficulty of parents trying to put together their own team or to know who they should see and when and what to expect, frankly. And I think providing hope is a big part of what we do too. And right at the very beginning with our prenatal consults, and we're talking about what are ultrasound findings, to have a role at that really poignant moment in a family's journey, and to be able to show them that everything will be okay. In fact, it'll be better than okay. Their children will be amazing individuals with just a little bit of need in these areas. And it's a privilege to be a part of those moments.